A pre-nursing student recently asked me, Nicole, it seems like critical thinking is pretty important in nursing school. Does your study method, the Silver Bullet study system, and the other ways you tutor help with critical thinking? Quick side note, she asked me this at my last pre-nursing boot camp class, and I've got another one coming up soon. So if you'd like to attend, check my bio link to see if you're watching this video and it's still coming up, or if you've missed it. So first of all, yes, obviously critical thinking is hugely important in nursing school. In fact, it's the number one skill you're in nursing school to learn. And it's really easy to forget that fact when you're being told, oh, you have to read 11 chapters before your next exam. Because then it's really easy to kind of get stuck in the rat race of thinking you have to know everything, which makes you start to believe, oh, I'm in nursing school to learn all the things. You're not actually in nursing school to learn all the things. There's a certain foundation of knowledge you do need to know as a safe, effective beginning nurse, of course. But memorizing every little detail in the caption on page 329 of your med-surg textbook, you don't need to know that to be a safe, effective beginning nurse, but you can still pass your tests when you study the way I teach you to study. Because critical thinking is really just a fancy way of talking about your clinical judgment. And clinical judgment is the number one thing that NCLEX tests you on. It's so important that they even changed the entire NCLEX test plan last year to make it better at testing your clinical judgment. Which is why your study habits have to match the thing that you're actually being tested on in nursing school, which is your clinical judgment. And I can tell you for a fact, after 15 years of being a professional nursing tutor, that most nursing students study for content knowledge and not to develop your clinical judgment. And it's actually easier than you think to make that adjustment, make that change in your study style. I actually have a free 10-minute video overview that teaches my Silver Bullet study system. If you want to grab that, I'll run this side, go to the link in my bio. Because in order to develop your clinical judgment, number one, there is some info you need to know, by the way, but it's probably not what you think. And this is where like steps 1 and 2 of my Silver Bullet study system come in handy. But then you have to go to phase 2 of studying, which is practicing how to think about what you have studied. And this gets into the application and analysis type questions so that you'll be more prepared to know how to answer them, how to think through them, how to develop your own rationales, how to prioritize your nursing care when you get to your exams and when you're in clinicals and dealing with real patients. And honestly, this is what sets me apart from all the other, nursing school memberships you see out there and all the other nursing tutors you might be able to find. Because I am never going to just spoon feed you information. I mean, I do weekly group tutoring sessions with my tutoring members. I have a group tutoring membership. If you didn't know that, you can join if you want to. All the information's in my bio link. And people ask me content questions all the time because that's what you do in nursing school, and that's fine. And I answer those questions, but I'm not just spoon feeding my students that information. Instead, I'm explaining to them how they can study that information for themselves, how they can independently connect the dots. For example, last night, one of my students is like bombing pharmacology, and that's why she joined my group tutoring membership. So I walked her through how to use and how to apply the Silver Bullet study system method to a topic that's on her next test, which she's doing respiratory medications. So we talked about decongestants. And by the end of that conversation, that's not the only question I answered during the group tutoring session, but by the end of that conversation, there's only like 7 or 8 students there, so it's not a huge group. And every single one of them, even though not all of them are currently in pharmacology, every single one of them is like, oh my gosh, thank you so much. I understand this so much better. And now I know how to go apply it to the stuff I'm currently studying in nursing school because it feels less overwhelming. We call it the Silver Bullet Study System, SBSS for short. But me and everyone in the membership, we joke that it actually stands for Sit Back and Sort Spaghetti. Because I explain that feeling of overwhelm you get in your head as spaghetti brain. Can you relate? So yes, the way I tutor 100% helps you develop your critical thinking in nursing school, but because more importantly, it helps you develop your clinical judgment. Make sure you give me a follow for more nursing school tips. And if you want to join my pre-nursing boot camp and you haven't missed it yet, you can get that link in my bio as well.